It's 3:30 p.m. on Monday, April 6, 2020. Thank you for joining us. I am Janet Hill, the Chief Operating Officer of the Rock Island County Health Department. We are joined by Nita Ludwig, the Administrator of the Rock Island County Health Department, and Ed Rivers, Director of the Scott County Health Department. Both of them will make prepared statements today. We also will hear from Rich Whitaker, speaking on behalf of the Quad Cities Behavioral Health Coalition. He will talk about managing stress during these trying times. Following all prepared statements, we will take questions. Please type your questions in the chat box, and the question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. As far as cases go in Rock Island County, we are reporting 5 new cases, bringing the total to 51. Ed, what would you like to say?
In Iowa, we have a total of 946 cases. The announcement for Scott County today was for 52. We also announced over the weekend the first report of a COVID-19 death in a Scott County resident. This resident was an older adult, 81 years or more of age. We've had an increase in results reported by the Iowa Department of Public Health, but this doesn't necessarily mean we've seen a spike in cases. I believe the last time on Friday when we reported, our total might have been 25, but that doesn't mean we've had 27 cases over the weekend. It's just that tests are coming in from the labs and the onset date of these cases is spread out. But regardless, we know there's community spread in our community, and an individual can be exposed without even realizing. That's why social or physical distancing of individuals remains vital for our community. We noted on Friday that we're working on a method for getting you information about the status of cases. This is the information we're able to put together of the cases that were reported. These are the current statuses, and there are currently hospitalized 7 cases, discharged and recovering at home 1 case, never hospitalized 6 cases. In the category of recovered, which is where we put the case when we're done with our monitoring of them, and based on the criteria we moved them to recovered, 37 have recovered, 1 deceased. I want to talk a bit about masks. As you know, the CDC has now stated that individuals should use cloth face coverings, and we note that this is cloth face coverings in public settings where other physical distancing of at least 6 feet is difficult to maintain, perhaps in grocery stores or pharmacies, and especially in areas of significant community-based transmission. The use of these simple cloth-faced coverings is intended to help slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. Now, you notice I didn't use the term mask. Surgical masks and N95 masks are important personal protective equipment that is needed for our healthcare workers and first responders. Members of the public should not use surgical masks or N95 masks in order to help preserve them for workers who need them. We'd also like to add a note of caution to this guidance. Wearing a mask in public does not minimize the need to practice physical distancing and hand washing. This will still be our greatest tool for helping slow the spread of COVID-19 in our community. Remember, if you're listening to our plea to stay at home as much as possible, your likelihood of catching the disease is decreased, and your likelihood to spread the disease is decreased. Your response is in your control. As we noted last week, individuals in our community have been asked to make sacrifices and stay home for the safety of our community. And we're asking our community to continue this stay-at-home effort, knowing that it will help us save lives. We know that an event such as this makes many of us feel like we have very little control of our circumstances, and Rich may talk about that more in his part of the prepared statements today, but we know that it will help us to save lives. We have, as a community, the tools to help us control how they respond to the spread of COVID-19. These tools include, and I hope this is not becoming monotonous, but I'll say it again, staying home as much as possible. Staying home will save lives. Maintaining a 6-foot distance between yourself and others when it's necessary to be in public locations, for example, grocery stores and pharmacies, and when outdoors. Cleaning and sanitizing high-touch areas of your home and workplace. If your employer has a routine sanitizing process in place already, great. If you have the ability to sanitize your workspace yourself, even better. Make sure it gets sanitized. And washing your hands, whether it's with soap and hot water or with hand sanitizer. We know that cleaning your hands is the best protection against the virus entering your body. You're in control of how you respond and your community needs you. As a last note, United Quad Cities for COVID Recovery is sponsoring an event today to support the Quad Cities Disaster Recovery Fund. United Quad Cities for COVID-19 Recovery is a 24-hour giving event taking place today. We encourage members of our community to consider this and other opportunities to support the COVID-19 response in our community. Information on local opportunities is available at the Together Quad Cities website.
Next, we'll hear from Nita Ludwig with the Rock Island County Health Department. Nita?
Hi, Brooke. Can you hear me?
Yes, I can.
Okay, thank you. We wanted to talk a little bit about caring for animals. We are hearing about animals becoming infected with COVID-19, including a tiger at the Bronx Zoo in New York. This situation is continuing to be evaluated as new information comes to light. Experts believe that dogs and cats are not easily infected with this virus, and the risk of transmissions to humans is small compared to the risk of human-to-human transmission. In addition to other prevention measures, people with COVID-19 and in-home isolation are advised to limit interactions with household animals. While a person infected with COVID-19 is symptomatic, he or she should maintain separation from household animals as they would with other household members. Avoid direct contact with pets, including petting, snuggling, being kissed or licked, sleeping in the same location, and sharing food. Designate to care for pets in the home if possible. Designate someone. Follow a standard hand washing practices before and after interacting with any pets, and coordinate care with the pet's veterinarian. And just like with visits to physicians, call ahead and inform staff that the pet has been exposed to COVID-19. Veterinarians can test for COVID-19 with state veterinarian approval. Residents are urged to make a plan for their animals to be cared for if they are unable to do so. It's easier to have those conversations about the continuing care of loved ones, including pets, before a crisis strikes. In accordance with the Americans with Disabilities Act, service dogs should be permitted to remain with their handlers. And then we wanted to take just a minute to recognize that this is National Public Health Week. In the midst of the most challenging public health crisis of our lifetimes, it's more important now than ever to celebrate public health and recognize the important work we do in our community's behalf. The COVID-19 pandemic means public health is the topic of the day worldwide, but most public health work is done at the local level. We are tracking all reportable infectious diseases and working with patients and physicians for contact tracing, not only for COVID-19, but any other reportable diseases in our community. We make sure the food served at local restaurants is safe through frequent inspections. We make sure infants, children, and adults stay on schedule for life-saving immunizations. We offer nutrition education and supplemental food for pregnant and postpartum women, babies, and children through our WIC programs. And with our close partners in the healthcare systems, we engage the community to identify health areas that need improvement and write a plan to make them happen. We are working for your health during this pandemic, and we will forge ahead when life returns to normal. We believe health and well-being are the basic human rights. Please join us in celebrating the public health workforce this week and beyond. Thank you.
Next, we will hear from Rich Whitaker from Vera Community Mental Health Center. And Rich, go ahead. If you can do *6 to unmute yourself, you can go ahead.
Okay, great. Can you hear me?
Yes, we can. Thank you.
Okay, excellent. Well, thank you, Ed and Nita, for your service to our Quad Cities community. Vera French is a member of the Quad Cities Behavioral Health Coalition. This is a community-wide effort to support the mental health needs of the Quad Cities. In the midst of the spread of COVID-19 in our community, it's vital that we all work together. You know, one of the things we're recognizing is that we're all under stress, maybe more stress than we realize. Well, it's normal to feel stress when we're placed in situations that feel outside of our control. It's normal to feel stressed when worrying about our community, our loved ones, our friends, and ourselves. Now, some of these signs of stress can include a disrupted diet, which includes maybe eating more than usual, or it could be a loss of appetite, even indigestion and heartburn that you don't normally experience, but those can be brought on by stress. Disrupted stress is, stress is also a cause of disrupted sleep, including difficulty getting to sleep, not staying asleep due to feelings of panic or even nightmares that maybe wake you up. It also could include sleeping too much. Stress can cause trouble with our emotions and thought processes. Irritability, a change in mood, or even an inability to focus and trouble remembering things can all signal high stress. Disrupted relationships are another warning sign of high stress. So what do you do? How do you reduce your stress and improve your body's natural immune system? We know from years of research that stress affects our immune system, and it affects the body's natural ability to ward off germs and viruses, and it affects our ability to heal when our body's trying to heal. So what do? You make sure you take care of your body by practicing good daily hygiene, getting some exercise every day, eating balanced meals, and drinking plenty of water. Another thing you can do is protect your ability to get a good night's sleep. Give yourself time to unwind each night by listening to relaxing music. Read a good book, or just unplug from media outlets. I can't overemphasize how important it is to take time to unplug from news and social media for at least a couple hours each day. Give yourself and your brain a break. The third thing you can do is share your feelings with a supportive listener, a trusted friend, a family member, your pastor, or a peer support helper can provide reassurance and understanding, and even help you think through your options. Fourth, I would recommend that you stay focused on what you can control. Wash your hands at every opportunity with soap and warm water, or hand sanitizer every chance you get. Practice physical distancing whenever you're out, and wear a mask to protect others. And choose to think about positive things and count your blessings to help you keep a balanced perspective. Now, if your stress is overwhelming and those things don't really help very much, you can take it one step further and know that it's so important to talk through what you're going through, but with maybe a good listener. But sometimes you need more than just a listening ear. During this time when you might not maybe want to visit a clinic personally to speak with your doctor or a mental health professional, most service providers are available by phone or video conference. Telehealth is a great opportunity during these times, and it's one that's been expanded by almost every provider so that you can get help without having to go and meet with somebody face to face and maybe put yourself at risk. So take the opportunity to call and set up that telehealth or that phone call with your provider to help to reduce your stressors and anxiety, because that's going to be a reassuring help for you in these difficult times.
Thank you very much, Rich, Ed, and Nita. We appreciate your thoughts and on the topics for today. We're going to go to the chat now to answer any questions that have been there. Please type in any that you have. We do have a first question, and we'll have Ed respond to this first. How do healthcare providers determine how to distribute scarce resources such as doctors and ventilators if there is a shortage due to COVID?
I know that the medical facilities in the Quad Cities are developing and refining their surge plans, and they know down to the physician and RN FTE what they can bring to bear if we have a surge in the community. But you could get more granular information directly from those facilities.
Thank you, Ed. We'll give it a minute. Please type your questions into the chat. Do you have another question? Just to follow up on the question about surge plans, are there public, county, or state guidelines or guidances on best practices? Nita, do you want to start with that question, please?
Sure. I think all healthcare partners have had pandemic plans for quite some time. I know that we at the health departments have developed those several years, and we update them all the time. So I am positive that our healthcare providers also have these plans and are reviewing them and looking at what their current needs are. We also know in Illinois, and I'm sure in Iowa, as a state, they are kind of reviewing what their potential needs would be due to surge activities and are requesting federal assets if that is a need.
The next question that we have listed, how many hospitals in Rock Island County discharged, never hospitalized? So I'm guessing that's some additional stats if you have that, Nita and Janet, for Rock Island County.
Yeah, and I would say, you know, we did have quite a number of new cases over the weekend that we reported, especially Saturday. We got 17 new positive cases. So the nurses have been working very hard today to make contact with those and start that contact tracing. So I don't think I can give you very accurate numbers at this point, but that's something that we're going to try to track a little bit better, and maybe we can report on that in coming days.
The second part to that question was long-term care facilities for seniors. Do you fear this will be a rising area of positive tests? Ed?
Well, the outbreak in the United States first started in a long-term care facility in the state of Washington. So I feel certain that our long-term care facilities here are working very hard to keep there being an outbreak in our local facilities.
Does Ed think Iowa should follow the same rules as Illinois? WVIK, can you give a little bit more information on that? Is that in regards to the closures of facilities and businesses? It has to do with the controversy that the governor has not issued a stay-at-home order. Ed?
I know there is enthusiasm for a stay-at-home order across the state, and the governor of Iowa has not instituted one. It was in the media over the weekend. The states that do not have a stay-at-home order, if you saw the governor's press conference earlier today, sorry, that was me. If you saw the governor's press conference earlier today, you know that she included many more types of businesses in her restrictions, but we remain concerned that certain businesses are still exempted from it.
Thank you. Can you please repeat the case numbers in Rock Island and Scott counties? Ed, do you want to highlight the new stats that we were able to provide for cases as well as the status?
Yeah, we are currently providing information on currently hospitalized, discharged and recovering at home, never hospitalized, recovered, and deceased.
And the total number of cases for Scott County now is 51, is that correct?
52.
52, excuse me. Rock Island, do you want to respond to yours as well, just for verification?
Sure. So today we are reporting 5 new positive cases, and 4 of them are isolating at home. 1 is hospitalized. Our total now then is 51 total positives to date.
Give another few seconds. If there's any additional questions, please type them in. Okay, thank you for joining us on the call today. Thank you again, Ed, Nita, and Rich for participating. It does look like the deaths in Scott County total 4 now.
No, it's 1.
Was the 52 new positives in Scott County? That was total positives, correct?
That is total confirmed.
Thank you. Again, as Ed has shared, and Nita as well, we know that there's community spread, so that does not indicate the amount of spread of the virus, but the total number of confirmed cases. So we encourage you to help us share the messaging of what individuals can do to control their response as we put in there. We anticipate that this information will come out to you in a press release if you need some additional information of what the talking points were for today. We do anticipate continuing to speak with you this week on these important topics, and as well as having some of our community partners join us to provide information that might be helpful to individuals in the community as COVID continues to spread in the community. So we will continue to do that. One last question, then we'll be ending for today. Is it because we have more tests available that we are confirming more cases, or what do you attribute to the doubling of cases since last Wednesday?
As I noted when we discussed our numbers, these are cases that are being reported out by testing labs. There's a number of lags involved in the time from when a person first experiences symptoms until we receive a report of a positive case. There's sometimes lag between developing symptoms and going to get a test. There's lag between the test being taken and the lab reporting it out. There's lag between the lab reporting it out and our receiving notice of it, and there's lag between that notice being received and it being published by the Iowa Department of Public Health. So those numbers, some of the times the tests pile up, for lack of a better word. A batch of tests will be reported out of a lab, and then they arrive and come to our notice, and we add them to our list of positive cases. But as we look at those cases we receive, we see that the onset date, which is the important thing for these reported positive cases, is spread out over time. So as I noted, these are not cases that just developed symptoms last week. It's over the course of time, even well back in to the first and second week of March.
Okay, thank you for that, Ed. Again, we appreciate your time, and we look forward to speaking with you again later this week. Have a good day.